Dr. Brown, try it now.
Okay.
Did it work?
Yep, there we go. Okay, I don't know what's the problem. Apologize to everyone.
Sorry about that.
All right. Okay, so I want to sort of set the stage for where we're headed with all of this, and just review some of this. I'm sure most of you have seen before, but it's all very relevant here. So I want to go over a few facts about our children. This is just children in the masses. By the age of 12, 70% have developed arterial or atherosclerosis. We have over 20 billion obese children in our country. I mean, we all know pediatricians now who are specializing in this. 1 out of 2 children will develop heart disease. 1 out of 3 will develop cancer, not necessarily die from it, but develop it in their lifetime. And these statistics, of course, match with adults in this area. 1 out of 6 will be diagnosed with a developmental disorder or behavioral problem. That's per the CDC and American Academy of Pediatrics. And then these numbers, you know, they vary a little bit, but 1 out of 150 being diagnosed with autism. Okay, 1 out of 88 in boys. And this is not initially where they're born with it. The majority of these kids are regressive onset. So as we all know, and that's why you're on this webinar, this is a big deal, and more of these kids are walking and coming into our practices. You know, and thanks to, you know, some of these people who are bringing this into the limelight, a lot more parents now know that they have options out there for their kids other than just pharmaceuticals, and that a lot of what we're doing makes a significant difference. And the majority, I'd say, I would go ahead and make the statement that this approach helps all children to some degree, and the majority of them significantly. Okay.
Are you able to move? Oh, there you go. Perfect.
There we go. Whoop. I think there's just a delay here. As you said perfect in mine, now I got to get it back. Okay. So why are we so unhealthy? Why are our children so healthy? In general, I mean, kids today are dealing with what we're dealing with as adults. Stressful type A lifestyles, extremely poor food choices. You know, we use the acronym SAD, S-A-D, for the standard American diet because it's really that bad. Not drinking enough purified water, lack of exercise. I mean, those top 4 things, I mean, that pretty much affects everybody. Those are big players in today's world. Inadequate amounts of essential nutrients. You know, most people who are taking things or giving their kids supplements are giving them a Flintstones, you know, which is chock full of all the things that they do not want to give these kids, and actually, you know, not a great source of any of these nutrients. You know, and on top of that, the chronic and excessive exposure to harmful toxins and pollutants, it puts our bodies, especially these little developing bodies, in environmental overload. All right, environmental overload leads to chronic degenerative disease. All right, now we're smooth sailing here. All right, chronic and excessive exposure. These are just a few of the stats. I'm sure you've seen these before. And some of these, actually, these numbers are much greater now. You know, over 87,000 chemicals. EPA allows 1,300 chemicals in our water. You know, and each year they raise the bar as to how much of it can be in there. All the additives, preservatives, you know, the things that are in our food, the pesticides and herbicides, you know, something like 85% of what's put out there, you know, only like 10 to 15% of it does its job. The rest gets in our food supply, into our water supply. All the antibiotics and hormones, drugs, both legal and illegal, pollution, and, of course, all the heavy metal exposure, which is, of course, big in this autistic spectrum disorder. These kids just do not detoxify a lot of this. Oh, I need to come to see if you guys are typing in questions. Okay. All right, and I put this slide in here. You know, I still tell parents the most important thing that they can do, you know, when they're nursing is to nurse. Mother's breast milk is still the best thing that you can use, especially over some of the choices that are out there. But just to show how far these toxins have reached, I mean, the body, as you all know as doctors, works really, really hard to keep this pure. All right, but even mother's breast milk, we're finding methylmercury, dioxins, and PCBs. All right, and of course, sometimes when I'm lecturing to groups where parents are here, they think, oh my God, I shouldn't nurse my child. But again, you can emphasize that it is very important to do so. It's just this is what we're up against. This is how far widespread metals are. They say the only unpolluted water left on this planet is frozen in the glaciers, the ice caps. And so this is what we're doing to this earth is, of course, we're seeing the consequences in the chronic disease arena. And here's another slide from the Academy of Child and Adolescent Psychiatry. An estimated 1 out of every 6 children in the U.S. this is very key wording here, has blood lead levels in the toxic range. Okay? Well, the scary thing about that statistic is blood levels of lead are still considered the gold standard for diagnosing lead toxicity, but I'm here to tell you that it's actually, the blood is a pretty poor indicator of body burdens of lead. Okay, if it's showing up in the blood, because the body works really hard to keep the blood, the serum, in homeostasis. If it's showing up in high levels in 1 out of 6 children, the body burden has to be very, very huge. Okay, because it's primarily stored in bones, and organs to some degree as well. And when you go on and you become more involved in this and begin doing some challenge tests and so forth, you begin to see how bad lead levels are in kids. So this is a very scary and alarming statistic. And this is just, another slide, a study showing that most of us have somewhere between 400 and 800 chemical residues in our bodies. And these things accumulate, they bioaccumulate. And it's this bioaccumulation that seriously compromises, our immune systems, our detox systems. And we already, we have a pretty good understanding that the detox systems in the spectrum children are not working. Now, what came first, the chicken or the egg, we're not entirely sure here yet, but we think a lot of it has to do with the excessive exposure into, if you genetically predisposed kids, if you will, and I say that kind of loosely, but we'll talk a little bit more about that. But again, most of us are detoxifying this to some degree. The kids on the spectrum are not hardly detoxifying these chemicals at all, especially compared to their neurotypical peers. Oops. Okay, is that slide completely pulled up for you guys? Oh, here it comes. If you get a chance, this is really moving slow for me, this is a good book. I think any type of doctor who's practicing in our realm of medicine should read this. Sherry Rogers is a medical doctor. She's an internist, environmental medicine doctor who's been really practicing this type of medicine for over 30 years. If you haven't read any of her stuff, you should. Everything she writes, she backs up with a lot of research references. Her book, Detoxify or Die, that's the book that I first learned about her and read. It's a very, very good book. Her newest one, maybe she has one since then, High Blood Pressure Hoax. These are both good places to learn a lot about this type of medicine and a lot about toxicity. And she quotes, and I agree with this, disease merely results from undiagnosed nutrient deficiencies and bioaccumulation of environmental chemicals to the point of symptom production. I 100% agree with that. And is the rest of the slide showing to you guys, Daniel? I'm only seeing that quote. What it does go on to... What's that?
Of disease merely results from undiagnosed nutrient deficiencies. I have that quote.
Okay, these symptoms resulting from toxic overload can manifest in a variety of ways. Migraines, chronic fatigue, fibromyalgia, irritable bowel, allergies, asthma, autism. Basically, toxic overload equals degenerative disease. There it is. Okay. And really, the thing that I want to point out here is this. This statement basically saying that most chronic disease is really tied into environmental overload. This makes sense if you think about it. If you take 10,000 people and expose these 10,000 people to a stressor, it doesn't matter if it's physical, mental, emotional, albeit whatever it is, we will break down where we are genetically weakest. A certain percent may develop cancer, a certain percent autism, a certain percent chronic fatigue, a certain percent depression, anxiety, irritable bowel. You get the idea. Okay, so really, all these things that we're dealing with out there on a regular basis, they all have labels, and the labels define a certain set of symptoms and signs. But basically, a lot of us in this realm believe, and there's a lot of evidence pointing to it, it's when your body becomes overloaded, when your cup becomes full, okay, and can no longer handle anymore, it begins to break down. And really, that's what we think is going on with autism. It's just happening at a very early age. There's a lot of similarities between chronic fatigue, fibromyalgia in an adult and autism in a child, a lot of the ways that you test and you treat and so forth. It's just one is in an undeveloped individual and the other is in a developed individual. Again, basically, I think boiling down to environmental overload. All right. Some of the signs and symptoms of toxic overload, you guys are familiar with these. I just put these up there. I mean, quite honestly, you could probably put up here just about anything. But these are some of the more common ones. And you see, several of these in the autistic population. And again, I won't spend much time on this slide. This is something that you all know about well. Okay. If autism equals environmental overload in genetically susceptible children, where do we begin in dealing with all this? And really that's the essence of this. I just wanted to give a little bit of background, kind of some of the common themes that are popping up. And I don't know who here has been to a DAN conference. If you have not, I highly encourage you to go. But you see that, in the 6 years that I've been going, you see the themes, progressively changing as we learn more and more. And I'm telling you, if you haven't been to one of these conferences, go. Some of the most brilliant minds in the world, research scientists, PhD docs, parents are there and lecturing, and because they are seeing more in their practice, or they know somebody in their family has been impacted by this. This has become so epidemic. And the thing about a lot of the things that are being utilized to treat the autistic kids, quite honestly, have a huge overlap in just about all areas of medicine. A lot of the chronic diseases that we deal with, because this, in my opinion, is the most complex condition that I treat. All right, so pathway to recovery. We're going to focus on the first 3 today. I mean, this is something I was just saying. This is very, very complex. And this could be easily a 2 or 3 hour lecture, but we're keeping it short. Just kind of some of the main pieces here. The elimination diet. All right, food allergies and intolerances. This elimination diet combined with the food allergies and intolerances, which we're going to talk about, top intervention for ARI surveys that helps kids. The 2 top therapies for surveys, again, from the Autism Research Institute, both to docs and to parents, are this elimination diet, okay, the foods, the diet, and 2 is detox, getting, all this stuff out of these kids. We'll talk about the initial supplementation, just kind of the basics, and functional medicine testing, the allergy testing, which is extremely important, the GI testing, and biochemical testing. Cleaning up, repairing, and supporting the GI tract is extremely, extremely important. We will not cover that today, as is supporting the liver and detox, preparing for detox, and of course prescription nutritionals based on the lab testing. All right, I'm going to move a little bit into food allergies here. All right, most of you are probably familiar with these and deal with this in your practice. If not, to me, this is something that should be done really on everybody. Okay, I think this affects everyone at least once a year, but when we're talking the autistic population, this becomes of paramount importance. And basically, this may be redundant to some people, but I want to go through it. Food allergies manifest when there's a combination of incomplete protein digestion, and can be for a variety of reasons, which, and increased gut permeability also from a variety of reasons. Can be food intolerances can cause it, introduction of allergenic foods at an early age, antibiotics, steroids, stress, heavy metals, overgrowth of, say, an anaerobic bacteria like Clostridia or Candida. I mean, a number of things. That's when this sets the stage for this condition. So when these large, incompletely digested proteins are absorbed intact and not broken down properly, they're in these long peptide forms, and they end up into the bloodstream improperly, passing through the channels improperly, if you will. It's almost like they end up into the body without their green card, so to speak. The immune system's job is to recognize them as foreign, and what happens is you mount an immunological reaction to foods, okay, which then creates inflammation, free radical production, leading to more oxidative stress, and these kids are just already overflowing with this anyway. And then, of course, you set up a vicious cycle. As you develop more food allergies, the minute these foods hit your GI tract, you get inflammation, and it exacerbates GI hyperpermeability. So the kids just get caught in this vicious cycle. This is a very important cycle to break. Okay, food allergy versus food intolerance. We talk about these. Unfortunately, these terms are used synonymously, but that's a little bit misleading. I want to spend just a slide on this. An allergy per se, which we tend to lump intolerance and insensitivities into the same category, allergies, really true allergies, are only affect a very few, small percent of the population, less than 5% on average. And that is an IgE mediated antibody response. And you all are very familiar with that. It's immediate. It can be anaphylactic. It's a histamine reaction, typically basophils and eosinophils. And right there's a stat on it. It affects 4% of adults and 7% of children. And food's avoided permanently. Okay, most of conventional medicine is still testing in this arena, the IgE area. You know, it's important to know, but most parents know if their child, they figured this out at an early age. They gave, you know, little Susie shellfish and she broke out in hives or her throat swelled, and all of you are all too familiar with this. But this is still where they spend a large majority of the time testing. This is nice to know, but it's not really what's impacting, you know, the kids we're dealing with the most. This is where we're talking more about the intolerances and insensitivities, the delayed responses. One thing I do want to note on the IgE, I have seen kids come in, though, with just unbelievable amounts of IgE allergies, and that's very rare. I get some really crazy complex cases. I have seen, they're supposed to be lifelong. I have seen IgE allergies improve and go away, okay? Clinically, I have seen that and have documented that with a couple of kids. So that's, you know, but for the most part, that's kind of the line of thinking and really not what we're dealing with. I just wanted to make a note of that. I do encourage, though, parents to have their pediatricians and primary care doctors do this, because if there is one that they don't know about, it could mask some of the benefits that we would be seeing from you know, the food avoidance that we're going to talk about over here, the delayed type, which we have listed under intolerance. It's delayed. It's more of a digestive or immune system response. They're unable to digest or properly process these foods. Affects probably more than 80% of the population. And these are foods that with avoidance and with repairing the GI tract and doing some other things that can be eaten again. You can reintroduce these foods. And, you know, ALCAT, of course, lays that out very nicely in their test and sets that all up for people. And I run ALCATs on upfront all the children in my practice on the autistic spectrum. And quite honestly, after having done this on myself and my wife and my 10-year-old stepdaughter, I recommend it to everybody that comes through my door. But it's especially important to these kids, to this population. Okay, some of the signs, symptoms, and conditions that can be related to these food intolerances and insensitivities, again, I could almost put anything up here. I have seen very strange things be associated with food allergies. All right, but these are some of the more common ones: hyperactivity and restlessness, mood changes and swings, poor sleep patterns, issues with reading and writing, issues with expressive and receptive language, okay, not only the delays, sneezing, coughing, wheezing. I mean, some of these even delayed things can look a little bit like an IgE-mediated allergy. And they typically manifest anywhere from a few hours to up to 3 days later. That's why it's so hard for parents or even oftentimes pediatricians or primary PCPs to correlate this. Because, you know, they may have had something on Sunday that they didn't have, and Tuesday or Wednesday they're, you know, just bouncing off the walls, or they're having aggressive tantrums, or they're stemming more, and parents just have no clue. It's just too hard to track. Even journaling sometimes can be difficult. And then, of course, you can see on the right-hand side the conditions that can be associated with this. And really, you know, the autistic spectrum, these ones on this list, absolutely food allergy testing, or I should say intolerance and insensitivity testing, is absolutely important. Autoimmune conditions, very huge. Some of the something's installing on my laptop. Sorry here. All right, some of the most common food allergens, most of us, again, are familiar with these. The ones on the left, the dairy, top, very close second, wheat, gluten, gliadin, okay, food additives, dyes, coloring agents, preservatives, refined sugar, soy. Something that's not on this list, but it's a big problem, are artificial sweeteners, aspartame, NutraSweet, sulfame, even Splenda and sucralose. Okay, the ones on the right, you know, again, common, not the top ones, but they're also very, very common. I hate putting chocolate up there because I do love it, but it does pop up with people. All right, when I pause, that means I just hit page down, and I'm waiting. For whatever reason, it's slow from my end. Okay, this is just kind of one of those things. One of the first steps that you want to do are eliminate foods that we know cause problems. I mean, Doris Rapp, she wrote the book The Impossible Child. I mean, she's been doing this sort of work for 30, 40 years. You know, people thought she was nuts back then, but now we know she was right on. And so I tell parents this is a modified Feingold. I send them to the Feingold website to learn more about this, but I tell them this is a modified Feingold because if you yourself as a doctor have been to this website or you send parents to it, they are going to be blown away. And they're already blown away when they leave our appointments, you know, covering all this information. But hence, you know, modified should probably be underlined here. The big gist that I want them to get from learning about this is to take out of their diet, and I usually do this in steps. Take out refined and processed foods, okay, as much as possible. Get that out. Refined sugar, artificial sweeteners, that's a huge one. Food dyes, additives, and preservatives. Usually week 1, this is what I'm having them take out. Okay, from their first consult. Week 2, I take out dairy. Week 3, I take out gluten, and I throw soy in the mix somewhere as well. But just, I send them to this website. I want them to know about this. You know, this Feingold website will talk about phenols and salicylates and a lot of other things as well. Typically, I have found between doing what I'm going to talk about, the casein-free, gluten-free, soy-free, basically everything-free diet, and the ALCAT diet, I rarely have to get that crazy of a full-blown Feingold, or rarely do I have to even go to the SCD diet, the specific carbohydrate diet that Elaine Gottschall came up with in the book Breaking the Vicious Cycle, which are even more restrictive than the casein-free, gluten-free, soy-free, you know, what I call everything-free diet. And by doing the ALCAT and doing the elimination diet, again, it's rare that I have to send a child to those next steps. Okay, I'm changing slides. Good, that one's smooth. Okay, now, something here, this is kind of, you know, one would assume this is sort of a no-brainer in, you know, really with everybody, but you will be, and maybe you're not shocked and surprised how many people eat like this, and especially kids, even neurotypical kids are eating a lot of this. When I started incorporating sort of blood sugar control suggestions to parents, I cannot tell you how many people emailed or called back and said, wow, that's made a huge difference, in addition to everything else we're doing. Okay, most of these kids, you know, they're carb addicts, just like, you know, most neurotypical kids, and they're even worse. All right, but we know as doctors this stresses the blood sugar control mechanisms. Okay, you get big highs and lows, which can cause big-time mood swings, irritability, focus and concentration issues. A number of things can be worse, stemming, I mean, just a number of things. And so I have parents, as best they can, and on top of everything else they're doing, balancing meals. Most of these kids, when you run the testing on them, they're not getting their aminos, they're not eating enough quality protein. Typically they eat chicken nuggets and that's all. So parents have to really begin to get creative and clever at balancing meals and increasing the protein intake. This makes a big difference along with everything else that you're doing. And I sort of had, you know, when I first started doing this a few years ago, I sort of forgot about this piece, you know, just the simple balancing and trying to get kids to snack between breakfast and lunch, between lunch and dinner. A lot of kids are grazers, and that's good, but a lot of them want to graze on carbs. Well, let's say they're on a gluten-free, you have crackers that they eat, and they love the gluten-free crackers. Well, I tell the moms and the dads, add a little bit of almond butter or cashew butter, you know, check the allergy test as well, too, and make sure they're not allergic to it. But add something that adds a little bit of protein or good fat or fiber. You know, if you can get them to eat nuts, even better. Again, so long as they're not allergic to something, because it helps stabilize blood sugar levels, and this goes a long, long ways. Also, you quit getting these swings. You know, when you take in all this sugar, and basically, as docs, you guys all know, the body, you know, all these simple carbohydrates are broken down very quickly into sugar. Well, we know that, you know, this depresses the immune system as well. These kids are already dealing with issues in that area. Approximately 70% of them are dealing with a chronic fungal and or, you know, bacterial issue. And sometimes you throw in the mix the viral issues as well, sometimes all three. Okay, so to compromise immune system, to compromise it even more by taking in sugar, which we know from numerous studies out there depresses like neutrophil activity, and it's very much dose-related. You know, so we want to do these little things as well, in addition to all the other Dan biomedical approach stuff that we're doing. Okay, step 2, and this is it. I've been alluding to this. You guys probably know this, but strict elimination of casein, gluten, and soy for 90 days, regardless if their ALCAT test comes back and says, which is very rare, that they don't have a problem with casein, gluten, or gliadin, and soy. okay, which you rarely see, but occasionally you do, and we're going to talk a little bit about that. But you have to get these out for 90 days, okay? Because even if they're not allergic, you may be thinking, why if they're not allergic? I get this question all the time. And many of you already know the answer to that, and that's the peptide issue. So in this population of kids, we're dealing with two things. We're dealing with intolerances and insensitivities to foods, and we're dealing with the peptide issue. Casein can be turned into caseomorphin, and gluten and gliadin also into these opiate peptides, which can bind to opiate receptor sites in the central nervous system and contribute and be causing a lot of the quote-unquote autistic behaviors that we're seeing. So you've got two things you're up against here. And so I tell them you have to do the ALCAT, the food allergy testing, and you have to do the 90 days minimum. And the 90 days minimum, I tell them, because I have them sort of gradually do this. You know, I give them about 3 weeks to get on this. And I tell them they'll make mistakes and so forth. So once they're completely on the diet, you count 90 days out from that. And then we reassess and reevaluate based on the ALCAT results and based on how they're doing clinically. Okay? Oh, where'd it go? Oh. Okay. I think I pretty much covered this, allergy elimination, and you know, by doing the casein-free, gluten-free, soy-free, you're eliminating the top allergens that we know about also. The peptide issue, we talked about that. Okay, what I didn't mention is the reason that these kids have this peptide issue is many of them are deficient in the enzyme called Dpp4, okay? And this is an enzyme that helps break down these particular peptides. This is also enzyme can be found on T cells. It's also called CD26. So this deficiency in this enzyme, which is very, very common in the autistic population, sets them up for this peptide issue, but also affects their immune systems by affecting the T cells. It's actually very complex. It's very interesting stuff, too, to delve into a little bit. And we don't know for sure why. Candida sometimes can inhibit this enzyme. We do know that. We also know heavy metals can inhibit this enzyme. And so, you know, and maybe there's some genetic SNPs that affect this as well. That's, I think, actually the gene, one of the genes that's associated with this enzyme is not too far away from some of the genes that have been sort of, and I don't remember the exact ones, associated with autism. So, you know, there's a correlation there, and so this is something I want you to be aware of, but that's the enzyme deficiency that's actually really contributing to this issue. And you can give enzymes. The question will probably come up. You know, Houston Nutraceuticals has some products that has Dpp4 in it. There's a few companies that are doing this now. Parents want to know, can I just give the enzymes? And, you know, no, not for at least the first 90 days. Sometimes we give them anyway in case the kids sneak something or slip up. Or, you know, it takes parents a while to figure this diet out. There's casein and gluten and all these soy. Things are hidden in a lot of foods and not labeled correctly. So sometimes we give it anyway. And but it can be something that can be used clinically, even during the elimination period, and then afterwards when you begin to introduce. I just want you to be aware of this. This is just a little bit more about it. I think I talked about all this. Yep. And this is just more. I think I covered this too. Organophosphates, heavy metals. No, Candida's not up there. And you can see there's some of the things. There's just a few more tidbits about it. But this is something you can look into. The ARI website will have info about it. You can Google it. It's actually a very interesting enzyme. I just put this in here. This is something that you could print out. This is, you know, I will hand this to parents. This is kind of an ASD optimal food pyramid, fruits and veggies at the bottom. Of course, it's very tough to get children to do that many, but, you know, this is in a perfect world, this is what we would do. Free range animals, and I emphasize to parents as much as you can organic. We're trying to reduce the overload in your kids. EFAs, nuts, seeds, and up top I have gluten-free, casein-free, soy-free treats. There's a lot of companies out there now that are producing these foods. This has become such a big deal. An ASD optimal food pyramid, anything else in here that we haven't covered? You know, a good rule of thumb for water is trying to get half their body weight in ounces of purified water per day. That I lectured with a pediatrician who specializes in obesity, like I was talking about earlier, who gave me this little pearl. This sort of helps you titrate water to just any size of person. emphasizing avoiding trans or hydrogenated fats. You can see these in the testing. You can tell when they're consuming these, whether they're sneaking these or parents are slipping up. You're able to catch this by some of the testing. Using rice, almond, and potato substitutes for dairy products since you're taking away casein. We'll talk about the supplementation. I'm sure most of you are thinking, if you're taking away dairy, do you need to add calcium? And absolutely. Oh, another biggie with the blood sugar deal and just minimizing sugar. I have all parents dilute their juices down, 1/3 juice, 2/3 water, and add stevia, liquid stevia to it, stevia. It helps sweeten it. And it's a natural sweetener. It's very safe, very healthy. Kids will think they're drinking full-strength juice. Okay, this is the basics of supplementation. Everybody goes out of my office with at least this, and then I'm waiting for the testing to come back before we get really into the nutraceutical, the prescription nutritionals. But a good multivitamin mineral, typically with iron and without copper. You have to watch copper in these kids. And periodically we'll run serum copper and zinc levels. These kids hang on to copper for whatever reason. They just don't seem to get rid of it. And they're usually very low in zinc, which is antagonistic to copper. A lot of times you'll have to use molybdenum and so forth to bring these down. You want the ratio copper to zinc to be about 1. All right, vitamin B6, we know from Bernard Rimland, founder of ARI, early intervention, high-dose B6 for these kids. Very important. Magnesium, a lot of them are constipated. If they are having diarrhea, of course, you have to watch the magnesium. Diarrhea is not necessarily indicative of, they could still be impacted. So a lot of kids who do have diarrhea sometimes are still impacted and still constipated. So be thinking about that, and sometimes it takes further GI diagnosis to work that up. But magnesium is something that these kids need big time. You see that in the organic acids test. The calcium, of course, especially if they're dairy-free. Essential fatty acids. I like cod liver oil. I like Carlson's cod liver oil specifically because of the EPA, DHA content, the vitamin D, and the cis form of vitamin A. And if you don't know about that, I really don't have time to get into that now, but there's biochemically in these kids, most of the vitamin A that you find is the retinol palmitate. The cis form, is it Mary Megson? Yeah, Mary Megson's a Dan doctor who did a lot of research into this. This helps kids a lot, and so this is something that you can look into. And probiotics, of course. These kids usually have severe dysbiosis. So these are things that they walk out of my office on usually on day 1. Sometimes, give or take 1 or 2 things. Just depends on the case. Okay, get page down here. I'm waiting for it to pop up. Okay, essential fatty acids. This is something that's unbelievably important to these kids. I'm sure, again, most of you being probably somewhat involved with this arena know that. Again, my vehicle of choice is the cod liver oil because of the additional vitamin D and the cis form of the vitamin A. And these are just some of the benefits. I probably don't need to go over this too much in depth with you, but it's very important to make sure they're getting enough of these. Because these kids, when you run the essential fatty acid profiles, they're very deficient. And of course, as you all know, biochemically, you can manipulate these pathways of inflammation or anti-inflammatory. You can create the right types of cytokines, prostaglandins, leukotrienes, and minimize the others by proper dosing of essential fatty acids. And they tend to be deficient in both. Omega-3s and 6s, though, definitely tend to be more deficient in the omega-3s. Sometimes there's a lot of conversion problems, okay, from some of the omega-3s down to the other longer-chain fatty acids. So you have to take a look at that as well. Digestive enzymes. These kids, not only the DPP4 is that an issue, but a lot of these kids just have compromised digestion. And if you can use a broad spectrum one, that's even better, one that has the peptidases, proteases, lipases, amylases. I really like, and I don't mind mentioning the brand name here, Houston Nutraceuticals. I just send parents directly to their website. It's called Trienza. I've been waiting years, as most of us Dan doctors have, for Houston to come out with this enzyme. Incorporates its broad spectrum and incorporates the DPP4 and the no phenol. Okay, and so it doesn't have hydrochloric acid. Hydrochloric acid is a tough cookie. These kids need it, but the problem is most of them can't swallow capsules and tablets, and so you have to break it open. Of course, once the hydrochloric acid is exposed to something, it starts to work. But, I have had situations where we did it, and we just try to get it in them and down as fast as we can so it doesn't cause any burning upstream And you know, when you can do that, that's great. When the kids can swallow things, it's even better. And then I like the orthodigestine from Orthomolecular. It's 2-phase, but I rarely get to use that in these kids. Lab testing. Okay. These are the things kind of where I start. You know, the CBC chem profile, hepatic profile, copper is very important to run, zinc, vitamin A, know where their vitamin D status is. Most of these kids are very deficient. You can do a serum B12 if you want to. We're going to get much more involved with B12 and some of these other tests. Heavy metal challenge, that doesn't even take place in my practice until they've been working with me, minimum of 4 to 6 months. You know, some parents rush in and they want to get the metals out and test it for metals, and I tell them, well, you just can't go down the detox route until everything else is set in place. A lot of these kids have methylation issues. If that isn't working right, you're ready. You're going to stir up a hornet's nest if both phases of the liver, phase 1 and phase 2, are not working properly. And a lot of kids, this is not happening. So I wait on that. My front line test. A parent comes into me and says, where do we start? I'm having them do the Platinum Comprehensive Profile, okay, from ALCAT. And I'm going to talk just a minute and just a second about that. The GI stool effects, all right, which is a very comprehensive GI stool test from Metametrics. I like Dr. Stata and Genovis as well, but I think Metametrics just raised the bar with that new one. It's DNA and RNA based. And the pediatric ion profile from Metametrics. Again, you can break these components out from any of the big boys, the big labs. They're all good. I just love Metametrics that they put it all together. There's what's in the ion profiles, the amino acids, the organic acids. They have a really good organic acids, the RBC minerals and metals, the fatty acid profile, the vitamin, mineral, antioxidant markers, oxidative stress markers, and even more. Okay, and so this is my frontline profile. These are what I run on everybody that comes through. Varies a little bit maybe if they come in with something else. But on the allergy testing, as I have them go to the website because ALCAT has a very good website. I have them look at a sample report. I have them read about the allergy testing. I explain to them. They'll know more about allergies, intolerances, and insensitivities than 90% of the doctors. They sit across from if they read through this website. I want them to be thinking like I'm thinking. These are not inexpensive tests. And I want them to understand as much as they can why I want them ordered. And when they go, so I don't even let them do the test that very day that they come in. I make them go home and read about these and learn about these. And I tell them that in addition to the casein-free, gluten-free, soy-free diet, we're doing the ALCAT because they want to know why. Well, one, you guys know the peptide issue for one. But if you're doing the casein-free, gluten-free, soy-free, everything-free diet, but you haven't tested for allergies, and there's a slide where I'm going to point this out, you may be masking the benefits of doing this test. You know, parents work so hard to do this, and what if they're allergic to, you know, foods that we consider healthy, like apples or oranges or rice or something like that? It could be masking the benefits of the elimination diet. So you want to have them do this for sure. I just tell them we've got to figure out a way to do it. Okay, and then they'll get on there and they'll see the different profiles. I occasionally, if the child is really small, okay, 2 or 3 will do the Comprehensive Wellness 3 panel because the kids are already fairly restricted. And I typically only recommend that if, you know, especially if there's a financial, we're trying to budget finances, I will let them drop down and do that. I used to do that all the time because I thought, well, it'll save them $500. But after having done this now and running a lot of ALCATs, the information that you get from running the comprehensive, you get the prescription meds, you get the over-the-counter meds, and you get 50 more foods, okay? That gives you more foods to choose from that are safe because these kids are already so restricted, and this is applicable to the adults as well. So I pretty much bypass most of them and run the comprehensive profile. That's just what I have found to be the most clinically important, but I just wanted to give you that little side note. And really little kids who are really picky, and if you get a family that comes in and they just say, I just can't afford it all, drop down and run that Wellness 3. It saves them $500, and for a 2 or 3-year-old, it's probably going to be enough to cover. And what you can do is as you work with them, you know, tell the parents to begin to put them away, and when you repeat, you can repeat with the comprehensive profile. But these are the 3 that I start with, and I think they're just all 3. You're looking at the GI tract, you're looking at the immune system, I mean the allergy, or intolerance and insensitivity, and then you're looking at all those other tests too. So those are my recommendations for you. Let's see, next slide. This is, whoops. This is the book. I keep these books around, okay? I think Alcat charges $5 a piece for these. And so parents and adults and whoever that come in, I say, if I give you this, because I tell them I pay $5 for this, I just can't hand them out to everybody. I want you to read it. And really, I tell them this title, Your Food Allergies Are Making You. Quite honestly, I think they should have taken the word fat off there and just left a blank underline, because this could really be, really this is, you could use this for anything. Any inflammatory condition, this impacts so many different things. You can see several doctors here have quotes about this, and I have one as well. But and I give this to parents, and I have them read it, and I give this to people, and I have them read it, and I have them go to the website. All right, this is one of the ways that I get parents to understand. If they understand why I want them to spend $900 on this test, okay, if they understand why, or whatever, the price of it is, why it's such a big item and why they want to do it, then they're willing to do it. They find a way to do it. Okay, because it's more expensive than some of the other allergy tests that you can get out there, but these are individual antibody tests. I explain to them, I'll get this question all the time, why Alcat over, somebody else who's doing the IgG or IgA or IgM. Well, some of these other companies out there doing these individual antibody tests, these are good companies and they're good tests, okay? But as you know as doctors, that's one parameter of the immune system, okay? An IgG test, that's great. I love having that information. Okay, and throw in IgM, great. Throw in IgA, now I've got 3 parameters. But Alcat, the beauty of this, and this is why I tell parents it's more expensive, it's more complex and more sophisticated, okay? It's lymphocyte-based, and you as physicians understand this. A lymphocyte not only responds to antibodies, it also responds to cytokines, and quite honestly, it probably responds to more parameters of the immune system, parameters we don't even understand. All right, so by lymphocyte-based testing, this just makes perfect sense to me as a clinician. Why would I, just do single antibody testing? In certain cases, yeah. Okay, maybe an IgA occasional, I'll have a reason to run an IgA, rarely, or more importantly, I'll have a PED or a PC run the IgE. Okay, sometimes that is important, more often than not. But as far as choosing between single antibody testing and lymphocyte testing, I think it's kind of a no-brainer. And once you help parents understand this, they get it, and they want the most broad spectrum. They want to know. So you may be missing a lot. You may pick up the IgAs and the IgAs, the IgGs and the IgAs and the IgMs, but what if there's another immune response going on to another food like rice, which is supposed to be hypoallergenic, and yet maybe your child's reacting to it and you didn't pick that up? It could be masking the benefits. A lot of these kids that you have to take to the SCD diet because the casein-free, gluten-free, soy-free didn't work, it may be because other things aren't being picked up. All right, I think I just basically summarized this slide. Let me see, why Alcat for the spectrum kids, really for everyone. That's why right there. I've really gone over that, I think, in excess, probably. But I'm very passionate about this. I think this is very important. And again, after having ran this on myself and my wife and seen it, because I probably previously was just running it on kids on the spectrum, chronic fatigue, fibromyalgia, and autoimmune patients. And then after I did this on myself, I'm at parties now, and my wife has to pull me away. She's like, you can't talk to people about food allergy testing here. And but I do. It's just passion. And if I had my way, every single person, and I tell every single patient about it that comes through, once a year minimum, I think this should be done. You can stay ahead of the game. Let me see. I talked about single antibody versus lymphocytes. So hopefully my passion's coming through because I really do believe that deeply. Why Alcat for the spectrum kids? Really, we talked about this. Okay. What I was talking to earlier, let's see, gluten-free and casein, all negatives with diet still important. Yes. Okay, we talked about the casein-free, gluten-free, soy-free, everything-free diet is very important, even if they come back negative because of the peptide issue, okay? Or maybe they don't have peptide issues, so you still have to test for these other foods because, like we were talking about earlier, if you are avoiding these foods and you're not seeing a response, I'm willing to bet there's a 75% chance it's a food that hasn't been detected. So that's why I cover my bases right up front. But also, sometimes you see things, this is really interesting from a clinician's viewpoint. And this is why one of the reasons why you don't want to just test just gliadin or just gluten. I've seen people come back okay to gluten and gliadin, but they come back like severe or moderate to wheat. So something else in wheat is creating an immunological response in these kids or adults. I myself came back moderate to gluten and gliadin, but severe to wheat. So not only was I reacting to the proteins themselves, but other constituents in wheat. All right. In another example, I have a patient down here, GK. This is an autistic child on the autistic spectrum, who we did the diet with. We saw some benefit, but just not what I'm used to. And so we did the allergy testing. And sure enough, he came back moderate to rice. And rice, you don't see it pop up that often, but it does pop up. It's, when you do an old-fashioned elimination diet, one of the foods that you still allow people to have is rice. In this case, in this particular kid's case, it would not have worked. Probably wouldn't have seen the benefit. When we discovered this with rice, he was crying all the time. It's like he was depressed. Rice was the key behind this. The grandmother, even now, after having avoided for a while, she tries to reintroduce it. He's still sensitive to it. It for whatever reason, when we don't entirely understand, some mechanism we don't understand, and this child has rice again. I think eventually he will clear it, but until then he just can't. It makes him very weepy and he cries all the time, but that's how we picked it up, was the outcap testing. So it's just one of the things that I wanted to point out. Another case that I can think of that's really interesting is this was an adult. She came in, she had aphthostomatitis, these mouth ulcers. We were working with a lot of other things, but as a side, where I was hormonally balancing her, but she had these ulcers. We could not get rid of them. Originally, I just didn't even think about doing an allergy test on her because she wasn't really complaining of anything that I thought of. Finally, I broke down after having worked with her for like 9 months. We had everything else figured out but these mouth ulcers. We ran the Alcat on her, and she came back. I was allergic to, she was a vegetarian, some vegetable, maybe it was eggplant, I can't remember for sure, some benign vegetable. Got off of it, eliminated it, and then she never had another mouth ulcer, and she was able to eat that particular food again. So it can be very, very helpful. And this is just an example. If you haven't seen this, you can see the reds are severe. That's a 6-month avoidance. The moderates are, again, pretty significant. I have kids avoid those for a minimum of 3 months. And then the greens, of course, are all safe. And then they lay out a nice rotation plan for you, a 4-day rotation. Sometimes parents cannot follow that. They are just way too overwhelmed to do the 4-day rotation. I will tell them that if you need to, while you're working on this, depending on how complex it is, have the greens, avoid the severes and the moderates like you're supposed to. Go through the milds. Anything that these kids crave or have on a regular basis, circle, take out of their diet for 3 weeks. After they've been out of their diet for 3 weeks, allow them to have it every other day if you need to, if they need help, because these kids, sometimes you get them down and they'll eat like 3 foods. And so you've got to play a little bit with the mild sometimes in the greens. But bear in mind, I tell the parents, anything that they're having on a regular basis, especially until we work on that GI tract, they run the chance of becoming sensitive to it. Parents get this. They really do, and they become very savvy. I wait till the parents advance a little bit because you're already blowing them out of the water. And I tell them in 3 months you're going to be what I call an advanced mom and dad. You're going to get this, and you're going to be able to handle more, and then we talk more about the rotation plan. But you guys just sit across from them, and you'll know where they're at. But that's a little bit of a leeway that you have. But for the most part, I tell them to follow it like Alcat lays it out because that's how it's the most effective. I talked about this really, why everyone should take this test at least once a year, my personal experience. Just personally, knock on wood, I'm pretty healthy. Some of the things that I noticed, my wife says I snore. I don't think that I do because I don't hear myself snore. But when I came back, when I avoided wheat and some of the allergens that were severe and moderate, my snoring decreased significantly. Way more energy. I have high energy, but I was surprised. Those are the big things. And hay fever. For me personally, I have had it my whole life in the fall. When I avoided the foods, the severes and the moderates, I've been running this test for a long, long time, and I hadn't ran it on myself, and they kept after me at Alcat and said, you need to do this yourself. You need to, and I finally, Michelle, I'm sure you all know, and finally I said, okay, I'll do it. And I did it, and I have no hay fever in the fall if I stay off of my foods. If I have them, to whatever degree I have them, is to what degree I have hay fever. So just a side note. Let's see, staying ahead of your health, I think it's profile at least once a year. Yeah, it's huge. What's really interesting is you'll see the parents of these kids, they see what running this test does for their kids. Almost, I'll bet you 60%, 70% of the time, one or both of the parents run this as well. And one of the most common things that I see of the parents is, and of course we all know this, you decrease inflammation, you're going to lose weight. But losing weight is a nice side effect of this. and sometimes it can be one of the main reasons that you run it as well. But most of the time I'm running it for more severe issues. It's just a nice side effect. Okay. Let's see. Oops, did I go page up there? Oh, I sure did. Okay. So how do you market this to your patients when it has such a big price tag? Really, I think I gave you a lot of the clinical pearls. You have to believe it, and you have to get it. Do it on yourself and see what it does for you. I can think of probably 5 people, and I've ran this on hundreds of people, that I haven't seen a whole lot of benefit from. One was a personal trainer and one of her clients who already had a stellar diet anyhow. We barely found anything. Okay, so it's really rare that you see somebody who doesn't significantly benefit from this. So run it on yourself. You'll be surprised, and you'll know what your patients are going through, okay, when they're having to eliminate all these foods and expand their diet into other areas. Emphasize to parents that this is the #1 therapy that works. Again, the CF, GF, SF, everything-free diet, okay, and explain to them, reemphasize to them, by testing for the other allergens, these insensitivities, you're going to avoid the possible masking, or at least minimize the possible masking. And again, very few people, rarely, I can't even remember the last time I had to take somebody to an SCD diet, specific carbohydrate diet, okay, or go full-blown Feingold. It's because I really attribute the fact that I run this test right up front while they're doing the diet. Okay, let's see. Oh, yeah, that's another big important piece. That last bullet point there frees up immune cells to deal with other chronic issues. These kids, I'm telling you, they're already dealing with all sorts of immune system haywire issues. They've got, most of them, 70% Candida and or Clostridia and compromised immune systems. Well, that's one of the reasons their immune system spending all this enormous amount of energy attacking and creating inflammation and forming complexes to these foods. Well, you eliminate that, you decrease a lot of inflammation right away. When you run these oxidative stress, these DNA damage markers, inflammatory markers in the ion profile, you see how inflamed these kids are and how much oxidative stress that they're under. This is just one more big piece of the puzzle. We're getting close to wrapping up here. I know this has got a little bit long. I just want to mention the methylation protocol. Look into this if you don't know about it. These kids have huge, huge problems with methylation. As you all know, methylation reactions, billions of them take place in every cell every single day, and these kids have all kinds of hang-ups in this little circle. This has been very well studied at the DAN conferences by all these scientists from around the world. Methylcobalamin, folinic acid, the active form, the trimethylglycine, and TDGSH, transdermal glutathione, sets the stage for detox, something that you need to know about and look into. Very, very important. And pathway to recovery, so this is in summary, the dietary intervention and elimination diet, again, top #1 therapy that helps these kids. Lab workup, very important for guiding the treatment plan. Start them on the basics, and then let the labs guide you for the specific nutraceuticals. The ion profile will come back with so many different things. You can't even put the kids on everything. You just have to pick and choose the pieces, most important pieces. Clean up, repair, and support the GI tract. They've spent all this money on the ALCAT, allergy testing, and all these other tests. We need to begin to fix the GI tract. Eliminating the food allergies themselves will help decrease inflammation, begin to heal the GI tract. Supporting liver and detox, immune balance and fine-tuning, a lot of other therapies, broad range therapies, and persistent sticking with the plans. Tell them if they can make it 90 days, they will be in a new place, because they will know so much more, and their kid generally is in a very new place as well. So I think that's it. That's the last slide. Let's tell these parents, it's the road less traveled. That's actually becoming more traveled, though, with some of the work like Jenny McCarthy's bringing this to the limelight and so forth. And it makes a huge, huge difference in these kids. I've seen severely autistic kids become neurotypical, and I'm sure many of you have as well. So I will open it up for questions. I think Daniel has control now. And
yep.
okay, and I see a question. Why do the test once a year? Well, that's actually a very, very good question. In a perfect world, I do this every 6 months. It's just pricey, as we see insurance pay for more of it. The reason I think you do it at a bare minimum of once a year is because it's nearly impossible, just because of human nature, family, to have kids stay on a 4-day rotation indefinitely. It just doesn't happen. Kids slip. And the more you have of a particular food, the more you increase the chances of becoming intolerant or insensitive, right? Especially with the compromised GI tract. And so what I do is I have them do this test, and the first time I have them repeat it 6 months. Now, I don't have them repeat, like I have them do the Platinum Comprehensive Profile. I don't have them do the full Comprehensive Profile in 6 months. I have them repeat just 200 foods, unless they have a lot of severes and moderates to, some of the other things that are involved with the comprehensive. But I generally have them repeat the foods, and then you can kind of, as a clinician, go from there. But I'd say as a minimum once a year, so you stay on top of it, of what these kids, because all of a sudden they haven't been allergic to rice for a long time, and they've been having tons of rice, as they do, because rice is so many things. You run the risk of them maybe developing a sensitivity to it, and boom, if you test for it and find that you have it, it may have been why they plateaued, it may have been why they regressed, maybe it's what's held their progression back a little bit. So does that answer that to whoever wrote that? Let me see.
David, Dr. Farrell, I have unmuted you, so if you want to have a follow-up question, please feel free to ask. You are unmuted and you can talk right now.
Oh, okay. Well, thank you for the answer to that question. I do have a separate question, if that's okay to ask.
Okay.
I have some kids with autism who have a lot of problems with oxalates, and I noticed on the ALCAT testing that a number of foods that are high in oxalates are showing up as in the green section. Can you comment on ALCAT and kids with oxalate problems, and also kids who've got problems with salicylates and other specific components of food?
Yes, actually. So, like, if you go to that, they'll talk a lot about that on the Feingold website as well, and that's where I tell them, in the beginning, if they do, I have them do the ALCAT testing and the elimination diet, and I find in my practice that the majority of kids we don't typically have to go to where they have to avoid the salicylates and the oxalates and even the phenolic compounds. Now, if you do the ALCAT testing and you do, if you're getting some of the obvious signs like the flushing, like with the phenols, you'll get some of the flushing and so forth. The parents will report. If it seems like it's a problem, then I will go there. Now, and some of the things that maybe aren't so obvious, if the kids are not progressing clinically, or they're plateauing, and you've got all these other things in place. You've done the methylation protocol. You've just done all the things. You've done the allergy testing. You've done all the other testing. Then I begin to go into those areas. Or if the parents come to me and say, "Hey, I read about this. I suspect this." I mean, I really listen to the parents. Parents are just way in, and nobody knows their child better than they do. And they're getting out there and they're doing research, and I'm telling them research, but do it in an educated manner and run it by me. If they suspect it, we try it. And so, and if you find out, yes, they're having a problem with oxalates, then what we do is we go in and fine-tune more. We go in and say, okay, so these are the green foods, and they're safe, but if some of these foods are high in oxalates, let's try taking them out for a period of time and see how your child responds. And so it's almost just, you guys kind of looking at the situation clinically and go, okay, maybe we are stuck. Maybe this is an issue. Sometimes you don't necessarily know until you eliminate something. Does that help?
Yeah, just sort of a quick follow-up question regarding that. What I'm trying to determine is what the information that ALCAT's going to give us, because if these kids have problems with oxalates, and
right.
You see that their ALCAT testing shows a number of foods that they don't seem to have a problem with, so is that basically telling us that ALCAT's not really picking up that oxalates are a problem for these kids, even though clinically it is?
Well, yeah, no, I don't think that's the intention of the test. But now I will tell you this, and so like I don't typically go to those areas first because it's just adding more complexity to what they're doing. But if you know right away that this is an issue, that's one more piece of information that you have, and that's great. So what I have found is, remember we're talking about this concept of overload. Okay, these kids are overloaded. If you take away, let's say that you have a child on the spectrum who's dealing with candida issues as well, okay, and Clostridia. You treat the Clostridia, you treat the candida, you eliminate the food allergens, maybe you're working on methylation, maybe you've taken away the peptide issue. All of a sudden now, their cup, which was full, has now dropped down to about halfway. All of a sudden, things that they sometimes have reactions to, you see them go away. You know, like they're not as strong of a reactor. They can begin to tolerate more, because a lot of airborne allergens, in my clinical observation, are secondary to underlying food allergies. So if you take away a lot of the things that are contributing to their overall, let's say, oxidative stress capacity, okay, and you reduce that a lot, it's almost like they become more tolerant. Maybe salicylates and phenols bothered them before, okay, and then you drop the load of what they're dealing with, all of a sudden it doesn't seem to be bothering them anymore. Now, that doesn't hold true all the time. Sometimes you have to eliminate these things. Sometimes maybe there's some genetic SNPs, maybe there's something that's going on that they'll always have problems. Because this is a very special population, and every single child is different. But the majority of time in my practice, I don't, and I think it's because I do so much of it up front, I don't generally end up having to go there unless, you know, somebody comes in and says, hey, I have an issue with it. But if you ran the ALCAT and you know about it, you could just sit down with them as their doc and say, okay, we already know oxalates are an issue. I know we're trying to reduce overall load. Well, even though these are safe foods, we're going to take them out along with these other foods, and maybe you could reintroduce them again, you know, 3 months down the line and see if they have similar reactions. Just a thought.
Thank you.
You're welcome.
All right, I'm going to
All
mute
right.
that. We're going to go to Joy Pacito now. It looks like she wants to, her question was, do you maintain the GF, CF, SF even after a retest?
Okay, that's a great question. That comes up all the time. Yes, typically I do. What we do, though, is now, it depends on how it came up. Let's say they came back on the ALCAT as having an issue with casein and gluten, okay? And so you keep them casein, regardless of whether they did or didn't, you're going to do the 90-day trial. Well, let's say, you know, they did come back. So I make them maintain that diet until we retest the ALCAT, which I typically do in 6 months. Then after I retest and they come back okay for casein, gluten, and soy, say they've cleared these and there's no allergenic component to gluten, gliadin, to any of the components, what I will do then is say, okay, we've got two choices. One is you can do some urinary peptide testing, but, you know, I think to me, in my opinion, the best company for doing the urinary peptide testing is Shattuck's overseas, but it's such a pain in the rear to do because it's overseas and takes forever. What I then turn to, I'm like, okay, they look cleared on the ALCAT. So what I will do is then do, you know, begin to rotate these in again. Try to keep as many variables as you can stable, which, you know, is a tall task, but you do your best. And you let them, you just pick one, you know, have the parent pick something that they know the child likes. And they introduce it every 4 days, so it's just a reintroduction of it. And if they're doing well clinically, they're not regret, you know, and the parents will know what they're you know, I'd say 75% of the time, parents instantly know, especially when you've gotten this far with them, the parents are becoming much more savvy, they know what's going on. You get it back in and they'll see a reaction. They know when something's off. And, you know, usually it's the mom that's a caretaker. She'll be able to pinpoint it right away. But you simply put it back in, and I tell the parents, if you suspect, even suspect, as you're reintroducing that this is the food, pull it back out again for 3 weeks, you know, and then you can try again. And only try one food at a time and watch it for 2 weeks. You know, watch it for, do an every 4-day trial. And I tell them, you've got to watch it for up to 3 days because it could manifest a couple days later. So that's how I have them do it because it's so, we know it's so important. That casein-free, gluten-free, soy-free diet is such an important piece for the majority of these kids. And even after like 6 months of ALCAT and casein-free, gluten-free, soy-free, you know, if we're not seeing benefits, I'm still, which is rare, you know, I'm still, parents are starting to think that they're not, that it may not be an issue. I'm still stick with it. And then I have them talk with nutritional people I have trained in it. Sometimes you find out that the parents are, you know, the kid's sneaking something or the parents are giving them something that they're unaware of. You just kind of have to dig deeper. I think I elaborated a little bit more on that, but did that help?
Yes, thank you very much.
You're welcome. Oops, lost it. Okay, what question do we have next?
Looks like it is with Dr. Solansky, I believe. And let me see. It says.
Oh, on retest. Okay.
Yep. On retest, do new foods show up often? Is it a risk to get new sensitivities? So let me just.
It is a risk. it's always a risk to get new sensitivities depending on how they're doing. Now, what I see is the people who are more compliant to the 4-day rotation, like they're supposed to, see way less new food show up. But what happens in a lot, I don't know, probably 50% of the time is parents are really good at avoiding the severes and the moderates, somewhat lax on the milds, but some of the greens, just because, quite frankly, the kids are so picky, and because of other sensitivity issues, that yes, you see some of the foods that they've been eating on a regular basis. And so what's so funny is when the test comes back, the parents, before you even get into it, will say, "Oh, yep, that makes sense. He couldn't have this, so we've been giving him this, and he's been eating the heck out of apples now." And you see apples show up. So one, what that tells you is you have a lot of work to do in the gut still, okay, when you see that happen. And so this is definitely a complex answer. It just depends on so many things. How much is going on with the gut? How much have you worked on it? How well are they following the rotation diet? And quite frankly, sometimes you can't get that gut is ongoing. Why some of these kids have chronic candida issues, and you get rid of them, they come back, you get rid of them, you come back. I mean, sometimes it's metals, and you just haven't even got to the metals yet. So does that help answer that, Dr. Slansky? Are you there?
Dr. Slansky, we unmuted you, so you can talk if you'd like. There? All right, let's go on to the next. Go on to the next question from Dr. Krieger-Fiedler. Let me unmute her. 1 second. All right, Dr. Krieger-Fiedler, you can speak now if you'd like.
I just wanted to ask a question about cod liver oil. According to recent research, they are saying that the ratio's off because the excessive vitamin A can interfere with vitamin D benefits, and I just wanted to know what you thought about it because you are recommending cod liver oil in your regimen here.
Yeah, right. Okay, so and I've read some of that too, and actually, now one of the pieces that I read was a doctor, and I can't even remember who it was, but I think it's fairly well known, and was making a comment on this. And the interesting thing that he said about what?
I believe it's Dr. Mercola.
That's exactly right. I read that piece. And so that was actually a really interesting piece. And the thing that he said that was interesting is if he had to pick a cod liver oil, I think he had to pick a fish oil. If he had to pick one, he'd pick Carlson's because of the ratio. And that's exactly who I use because I think he's right on. I mean, I love Nordic Naturals as well and sometimes use them. It just depends on the child. But their ratio is, I like that higher level of I like a little bit higher level of the cis, like Carlson's has, of the cis form of the vitamin A because of the benefits behind it, and then the vitamin D. And what, he said in that article, and you correct me if I'm wrong, but if you increase the vitamin D so that the vitamin D ratio is a little bit higher, then, then you still get the benefits of the vitamin D. And quite frankly, when you test, that's what you see. The majority of these kids need, as do most adults, more vitamin D. So we are supplementing usually. Again, it just depends on the test. The vitamin D in addition to what the vitamin A that's already in there. And so I'm actually, kind of sitting back and watching and waiting too to see what, there'll be more. This will be more looked into, I'm sure. And I wonder, and maybe you know the answer to this, if the research, because I was just reading, I think what you're referring to. I don't think there was a huge amount of references in there. At least when I buzzed through it, I didn't have time to look at them, but. If there was any research done on the retinol palmitate versus the cis form of the vitamin A, do you know?
No, I didn't read it that closely myself.
Yeah, and I was like you. I skimmed through it, and well, actually, patients, and I'm sure the same thing happens to you, sent me that. I found that very, very interesting, and but I also found it interesting that he went on to say that if he had to pick one, he'd pick the Carlson's brand, and that's the one that I use. And then he's talked about just bumping up the vitamin D a little bit, which, again, most of these kids need. You just follow it through testing. And so, but I, again, am waiting to see if, the literature, if it comes out, if, maybe it's the retinol palmitate, which still has benefits, of course, but maybe it's the retinol palmitate. I bet you Mary Megson, it'd be interesting to see if she looks into this a little bit more. Have you read any of her work?
No, I haven't.
Yeah, she's the one who really elucidated the benefits of the cis form of the vitamin A and why that helps some of these kids with peripheral vision so many times. I've seen some of these kids in my practice go to get surgery corrections. The surgery did nothing, and I kept trying to tell them, try this the cis form of this vitamin A first and see if it makes a difference. And I saw a couple kids where that's what corrected it. So if you get a chance, delve into Mary Megson's work a little bit. And if you run...
How do you spell her name, please?
Mary, just like it sounds in Megson, I believe, is M as in Michael, E-G-S-O-N. Mary Megson,
Okay.
I believe. And she's a Dan doctor. She might be a PhD doc, but...
Okay, thank you.
And if you, yeah, you're welcome. If you run across anything, shoot it to me as well.
Okay, will do.
All right. Thank you. And I think Dr. Krieger Fedler had a question.
Fiedler, yeah.
Yeah.
Fiedler, are you still there?
Yeah,
Yeah,
I'm done.
Yep, that was just her question.
Oh, that was your question. Okay.
So I'm going to, Dr. Barold has one more question, so let's go to him now. Dr. Barold, if you'd like to ask your question, please feel free to go ahead and do so.
Sure, okay. My question is that sometimes there are people who have a food intolerance, but it may not necessarily be picked up by ALCAT. I was just trying to understand what ALCAT is actually testing for. I understand that it's checking certain parameters. And that's kind of why I asked that question with the oxalates as well, is what are there certain things that ALCAT necessarily may not necessarily pick up? It's, to me, it's the most comprehensive test that's out there. It's
I agree.
But it's, what are the limitations, essentially? I know there is no test that's out there.
No, I agree. I think you're absolutely right. No, I think that, oh God, I mean, if we can get the research gurus behind the ALCAT front lines to include the oxalate and some of these things that we have to deal with, that'd be even more awesome. I think it just gets into so many more complexities. But I think you probably read, if you've read their methodology, it's actually very, very interesting and very technical. If you haven't read that, have Michelle or Daniel or somebody get that to you. I think you'll find that interesting. But, I agree, and I tell parents this too, because the parents will ask me this question. They'll say, well, what if this food, this particular food, we know it didn't show up on the ALCAT, it didn't show up on the IgE testing, and it didn't show up on the skin prick test, but we know, Timmy goes nuts when he has it. I'm like, well, you know what? We understand tip of the iceberg of the immune system, even with all that we know.
Sure.
Or in other parts, other systems. And so if you know or you even think or have an intuition that a food is creating an issue or, the oxalates are, the phenols, get it out of the diet. Let's see. You might be right on to something. I mean, this whole DAN movement is so parent-driven. Parents begin to figure things out because they want to get their kids better, and then all the doctors and scientists say, okay, wow, we're seeing this, but why? And they begin to look into it. So I think some of these things will become elucidated, and I'm with you. Yeah, there's no perfect test, and I'm in the same page that ALCAT is the most. I've been through lots of food allergy testing companies, and to me they're the most comprehensive and complete, but still don't get all of it. And so what we have to do as clinicians is kind of work with the parents like you do, and say, hey, if you think that this is it, let's try eliminating this and see what happens.
Sure.
I think it's point well made. Absolutely.
Thanks. I have one request.
Sure.
And that request is, I may have mentioned this to someone in the past when I actually went to DAN conference. Were you at the DAN conference?
I was. The one in San Diego?
Yeah. I think I may have spoken with you, or I can't remember, but I was the one who requested the one about the milk. The milk testing, the raw milk.
Oh, are you with the group, the Raw Milk Foundation,
Yeah.
or?
I've actually had some people who do extremely well on raw milk, but then as soon as they have pasteurized milk, they have a hell of a problem. So
I absolutely remember you. That's a great idea. That'd be something to actually, you and I should get on the phone with Lee, or somebody at ALCAT. That's right. I do remember you. That's a very interesting, for those of you who are listening, we had this conversation about how kids who showed up intolerant, right, and had actually had clinical issues with pasteurized milk, but on the raw milk, and you and I discussed the possibility of when you're consuming raw milk, there's a lot of enzymes that are there that are no longer there, and probably, quite honestly, there's a lot of proteins that probably either disappear or become denatured after it's pasteurized or homogenized that probably are, some sort of buffering system, or changing something in some way that allows these kids to tolerate that. That's interesting because there's research out there, empirical. I mean, there's lots of research out there that shows some of these cultures that subside almost entirely on dairy, because most of us in this country and in our world of medicine, we know it's not such a great thing, but I usually make that little exception that if it's raw, which of course you have to be careful of the source, but these cultures who subside on raw dairy, they're unbelievably healthy. They don't have any of the problems that we see with it over here. And I don't know, would you like to elaborate a little bit further on that?
Yeah, I mean, I think you kind of hit the main points on it. Is that with the testing that's been done out there with the casomorphine, there's been some interesting things written out there as far as a lot of research. No, but some interesting papers written by some individuals that have talked about that's not much of an issue when you're dealing with raw milk versus pasteurized milk. So again, it could be the processing of the milk, which is making it extremely difficult for these kids to deal with it, and so it subsequently causes formation of these morphine-like peptides.
That's actually such an interesting thing because, I mean, to me that just makes sense that could be happening because we know you can denature proteins and change them, and maybe you're just changing, one or two of the amino acids that then allows this these opiate-like peptides to be formed, but but it doesn't happen. Or maybe there's, who knows? I don't know. Have you read anything? Maybe there's a higher content of a Dpp4-like enzyme when you're drinking raw milk, or something that allows, or other enzymes we don't even understand that help break that down. So,
well, there's a couple interesting articles that are out there, and I'd be happy to, I can get your email address. I'd be happy to send you some interesting things out there. I mean, there are growth.
I would love that.
Sorts of things in raw milk that they've tested. The other thing is cysteine versus cystine. When you start processing milk, you start to sort of cause cross-bridging of the amino acid, and so it makes it unavailable to the system.
Oh, no, that's really interesting as well. So a lot of these kids are deficient in that. So.
Yeah, I mean, the reason I bring all this up is because it can be a very nutrient-dense food if obviously it's coming from a good source, organic, etc. Because it's, for obviously those kids who need a source of a clean source of an animal, fat, protein, etc.
Well, it'd be really interesting if we could, it'd be neat to see if some of the companies like Alcat, who does the food allergy testing, could incorporate I don't know how hard that would be, a raw milk protein, casein taken from raw milk. And then what would be interesting is somebody maybe doing the urinary peptide testing, if they could, I'm not sure how that would work. You'd have to have test subjects who drink. I don't know. That's interesting.
Yeah, there's a company, Organic Pastures in California. It'd probably be more than welcome. I can get on the phone with them and be happy to talk to you about it. So, but anyways, I don't want to take up too much of the time. So.
Okay. Well, let's email me at my email, and we can talk further about that. You found that slide, and then it's physicianchoiceks@msn.com. Yeah, definitely shoot me an email if you think about it.
You bet. Thank you. Thank you for.
Thank you.
Dr. Hunter, I'm going to put these slides into a PDF tomorrow, and I think we'll be able to send them out to everybody. I don't think that should be too much of a problem, just so everybody's got it. So don't worry about that. The next question comes from Dr. Natasha Solansky. Let me unmute you so you can ask your question. All right, you are unmuted. Please feel free to ask your question. Dr. Solansky? Oh. Well, her question was, I would like to address a paradigm, eat a lot of fruits and vegetables, and ask a question verbally. So are you there?
Can you hear us?
I don't know. I don't know if she can hear us or not.
Maybe she didn't get that audio thing in.
Yeah, well, we can email her and we can have her ask you the question on her own.
Okay.
So
that'd be great.
Is there anybody else that has a question? I'm going to unmute everybody, and if you do have a question, please feel free to ask it right now. Otherwise, we're going to wrap this up.
Unmuted.
Does anybody?
Hi, it's Dr. Akey in Gainesville, Florida.
Hi.
Gainesville, go Gators.
Go Gators. Hey, I had a question about, that was an excellent presentation, Dr. Brown.
Thank you. Thank you. I hope it was helpful.
Oh, it's very personal. My son has Asperger's, so I've been trying to debate on myself becoming a DAN doctor. I'm an internist.
Oh, you should.
Yeah, after this talk, I was about to just pull up the website. But I was wondering your preference for EFA, essential fatty acid profile testing, which company and what test?
Well, I use Metametrics because I can run that ion profile, and that's automatically part of it. They have
Okay, great.
Oh, I'm muted now.
Thank you so much.
Sorry about that. I muted the wrong person there.
So, but I don't think you could go wrong with essential fatty acid profiling at either Genova or Metametrics, but that's just who I currently use as Metametrics.
Thanks. And a follow-up question to that, since I actually did ALCAT on my son Timothy, and we've been eating off the greens and then every 4 days the yellows, he has gotten a lot better, but we've kind of gotten slack, and it's been about 6 months, so I think we should go back to doing that. But I never did the strict gluten-free, casein-free, soy-free. Do you recommend we just start that now, or?
Yeah, you just have to do both, because even if you're following the ALCAT allergy testing, so many times the overlap is there, because if the ALCAT comes back and says you're allergic to casein and gluten and soy, well, you've got it covered. You're avoiding it anyway. But if it comes back, and I've seen it happen where it comes back and they're not allergic to one of those, well, if you're not taking it out, you may not be getting all the benefits, because even if the ALCAT says you're okay to soy, that means immunologically you're probably okay to soy. You may still be producing the peptides to soy or to casein or to gluten.
Now, how would I figure out if his gut's not inflamed anymore, if he needs heavy metal testing? I guess I could study your protocols and your slides a little bit closer, but do you think I could call you sometime?
Absolutely. I'd be glad to talk to you.
I'm actually working on him, and the closest DAN doctor is in Jacksonville, which is about 2.5 hours away. So I figure
absolutely. Yep.
Okay, and my name is
Ansley
Aiken. Thank you so much. I'll probably be calling you early next week. Appreciate it.
Okay, that sounds good.
That was excellent. Thank you.
You're welcome. Bye.
Looks like Robert Hunter has a question. Let me unmute him real quick. Robert, Dr. Hunter, are you there? Can you hear us? Can you talk?
Well, even if he can't, I see his question. Are you there?
I don't know if you can hear it. Let me unmute everybody.
All right.
All right. Dr. Hunter, can you hear us? Or can you talk?
I wonder if the people who can't talk maybe didn't get their audio pin in.
Yeah, it looks like he doesn't have his audio pin. I don't know. I don't know what's going on there.
Well, if you can hear us, Dr. Hunter, I'll go ahead and respond to that. I'm not sure what BioSet is, but NAET I've absolutely seen to be helpful. I'm not trained in it. It looks, for those of you who don't know what NAET is, I'm not entirely sure what it stands for, but it's a desensitization technique for foods. It looks a little woo-woo, but it works. And the thing that I tell, there's 2 nurses here in Kansas City who are trained in it, and I refer patients to, especially if they're really bad. The thing that I do emphasize to the patients is if you're not doing, you still have to do the allergy. I still think you have to eliminate the foods. I think you have to still work on healing the gut. Because if you don't, NAET will speed up the process, and it does help desensitize. But if they start consuming those foods and the gut is not repaired, guess what? You're going to, all that money and expense and time that you took to desensitize through NAET, they're going to resensitize to the foods. But it does speed up the process and help. And so I recommend it in certain complex cases, but you have to still do the elimination and the repair the gut. Hopefully that helps, Dr. Hunter. And if we can't hear you and you have any more questions or comments, you can get a hold of us as well.
Oh, there he goes.
Oh, there he said thanks. So.
Oh, you're welcome. I think maybe he couldn't hear us because the audio pin wasn't punched in, so.
Or we couldn't hear him. He could hear us, but we couldn't hear him. Yeah.
Yeah. So, all right. If there's any other questions, please speak up now, or please feel free to email us at ALCAT or Dr. Brown at his email address, which is up on the screen, and we'd be more than happy to help you out.
Absolutely.
Anybody else? All right. I guess we're all set here. I just want to thank everybody, especially Dr. Brown, for presenting to us tonight, and thank you, everybody, for attending. We will be following up with you, so please look out for an email from us. If you attended this webinar, we will be giving you a little tk you for this, because we do appreciate you coming into us. And I'm going to go ahead and shut down the software in just a minute here. Everybody, thank you very much, and we will be in touch with you soon. Take care.
Are you there, Daniel?
Here. Dr. Brown, I'll give you